So we've been able to modify polymerase to make it into a hot start polymerase, so therefore we can control exactly when it starts replicating.
Right.
We have integrated better proofreading capabilities, so therefore we are more precise in what it replicates.
Let's go!
Hey Joris, we did an episode a while ago about nature-inspired medical device technology, and I wonder if we can continue that discussion.
Thanks, Nick. I'm glad you asked this question because there is so many examples in nature of examples of how we use parts of bacteria and parts of humans and viruses that is in medical devices. And one particular example I want to speak about today is polymerase. Polymerase, of course, the foundational enzyme in PCR, in the polymerase chain reaction, and that's really again foundational to laboratory research all over the world. So that particular enzyme was actually discovered by, I have to say this right, Thomas Brock and Hudson Fries in almost in the summer of '69. We often think about that.
69.
It was actually the spring of '69.
Oh, wow.
But it was discovered in the hot springs in Yellowstone Park. So when you see these beautifully covered hot springs, there was a bacteria in there, and they discovered this bacteria and found that it was extremely resistant to high temperature.
Sure.
And that was needed because these enzymes are therefore very resistant to temperature, and in the polymerase chain reaction, you actually have to split open the DNA strands using hot temperatures, and then you need to have enzymes that are working at those temperatures. So in Thermus aquaticus, the bacteria that they discovered in those pools, they found this enzyme that could replicate at those temperatures, and since then we have discovered in '83 we discovered a polymerase chain reaction.
Right.
And
that was Carey Mullis.
Carey Mullis discovered that, yes. And that reaction is central to molecular testing, so it can test for infectious diseases, genetic testing, also forensic science and forensic testing. So many different assays and medical devices are reliant on that technology.
Yeah,
and then if you think about these enzymes, they have been evolved over millions of years.
Billions, 3.5 billion by my math.
Billions of years. But humans have been able to modify these enzymes for their, to make them even more specifically tuned for their fine application. So we have been able to modify polymerase to make it into a hot start polymerase, so therefore we can control exactly when it starts replicating.
Right.
We have integrated better proofreading capabilities, so therefore we are more precise in what it replicates. And more recently, we have discovered enzymes that can do isothermal replication. So that means that instead of having to cycle throughout like a molecular test reaction or a polymerase chain reaction, we can now keep the temperature constant, which then enables a much easier workflow and a medical device.
Yeah, absolutely. Well, great example of Taq polymerase. And again, as microbiologists, we'd be remiss, of course, for not saying the Taq stands for Thermus aquaticus.
Absolutely.
And fantastic example. Where would we be without PCR? Amazing.
Exactly.
Great.
So with that, you have a great day.
Great day.